Question 1. A phlebotomist is preparing to perform a venipuncture. Which of the following is the most important step to ensure patient safety? A. Donning gloves. B. Verifying patient identification. C. Assembling equipment. D. Applying a tourniquet. Answer: B. Verifying patient identification. Explanation: this question tests understanding of patient safety protocols, specifically the most critical initial step before drawing blood. The keyword "most important" highlights the need to prioritize foundational safety. Verifying patient identification using at least 2 unique identifiers, like full name and date of birth, is paramount to prevent medical errors and ensure the correct tests are performed on the correct patient. Without proper identification, all subsequent steps, no matter how correctly performed, could lead to drawing blood from the wrong person. Always double-check patient identity against the requisition form. It's a fundamental rule for patient safety. Question 2. Which of the following venipuncture sites should be avoided due to the risk of nerve damage? A. Median cubital vein. B. Cephalic vein. C. Basilic vein. D. Dorsal hand veins. Answer: C. Basilic vein. Explanation: this question focuses on safe venipuncture site selection, specifically identifying areas with higher risk. The keyword "avoided" and nerve damage points to a vein that lies close to nerves and arteries. The basilic vein, located on the medial, pinky finger, side of the arm, is generally less preferred because it runs close to the brachial artery and median nerve, increasing the risk of accidental arterial puncture or nerve injury. Although it can be used, phlebotomists should exercise extreme caution. Always aim for the median cubital or cephalic veins first, as they are safer and more superficial. Question 3. A phlebotomist observes a hematoma forming at the venipuncture site. What is the immediate action the phlebotomist should take? A. Apply a cold compress. B. Elevate the patient's arm. C. Remove the tourniquet and needle. D. Apply pressure for 10 minutes. Answer: C. Remove the tourniquet and needle. Explanation: this question addresses immediate actions during a venipuncture complication. The keywords hematoma forming and immediate action mean you must act swiftly to stop the bleeding under the skin. The first step is to remove the tourniquet and then the needle to release pressure and stop further blood from escaping the vein, which prevents the hematoma from growing larger. After removal, direct pressure should be applied. Think of it as stopping the cause of the problem before trying to manage the symptom. Question 4. What is the correct order of draw for a venipuncture when collecting a blood culture, a light blue top, and a lavender top tube? A. Light blue, lavender, blood culture. B. Blood culture, light blue, lavender. C. Lavender, blood culture, light blue. D. Blood culture, lavender, light blue. Answer: B. Blood culture, light blue, lavender. Explanation: this question tests knowledge of the critical order of draw, which prevents cross-contamination of additives between tubes. The specific tubes mentioned are a blood culture, sterile, light blue, coagulation, and lavender, EDTA. According to CLSI guidelines, the order of draw starts with sterile collections like blood cultures to prevent contamination, followed by coagulation tubes, light blue, to avoid activating coagulation factors from other additives, and then EDTA tubes, lavender, due to the strong anticoagulant. Remembering sterile, coagulation, other additives can help you recall this sequence. Question 5. Which additive is found in a lavender top tube and is primarily used for hematology tests like a CBC? A. Sodium citrate. B. Heparin. C. EDTA. D. SST gel. Answer: C. EDTA. Explanation: this question focuses on specific tube additives and their primary use. The keywords lavender top tube and hematology tests like a CBC point directly to the most common anticoagulant for whole blood analysis. Ethylenediamine tetrashic acid, EDTA, is the anticoagulant in lavender top tubes, preserving cell morphology and preventing clotting by binding calcium, making it ideal for complete blood counts, CBC, and other tests requiring whole blood specimens. Knowing that lavender tubes are for counting cells makes remembering EDTA easy. Question 6. A phlebotomist is asked to draw blood for a PT/INR test. Which color top tube should be used? A. Green. B. Red. C. Light blue. D. Gray. Answer: C. Light blue. Explanation: this question tests knowledge of specific tests and their corresponding tube types. The terms PT/INR test are the key identifiers for coagulation studies. Prothrombin time, PT, and International Normalized Ratio, INR, tests measure how long it takes for blood to clot, requiring a carefully measured ratio of blood to anticoagulant. The light blue top tube contains sodium citrate, which is crucial for preserving coagulation factors, making it the correct choice for PT/INR and other coagulation assays. Remember that light blue is for clotting time. Question 7. What is the primary purpose of a tourniquet during venipuncture? A. To prevent blood from flowing back into the patient. B. To make veins more prominent and easier to palpate. C. To sterilize the skin before needle insertion. D. To apply pressure after the venipuncture. Answer: B. To make veins more prominent and easier to palpate. Explanation: this question asks about the main function of a tourniquet during a blood draw. The keyword primary purpose directs you to its main role. A tourniquet constricts blood flow, causing blood to pool in the veins below the application site, making them larger, more visible, and easier for the phlebotomist to feel, palpate. This helps in locating a suitable vein for puncture. It's like a temporary dam for blood, helping to make the target vein stand out. Question 8. A patient begins to feel dizzy and lightheaded during a blood draw. What is the phlebotomist's immediate priority? A. Offer the patient a snack and drink. B. Call for a nurse immediately. C. Remove the needle and help the patient into a safe position. D. Continue the draw quickly to finish. Answer: C. Remove the needle and help the patient into a safe position. Explanation: this question addresses managing a common patient reaction during venipuncture, specifically syncope or near syncope. The keywords dizzy and lightheaded and immediate priority indicate a need to prevent injury. The first and most crucial step is to remove the needle to prevent injury from an accidental stick if the patient faints, and then help the patient into a supine, lying down, or head between knees position to improve blood flow to the brain and prevent falling. Patient safety always comes first. The blood draw can be reattempted later if necessary. Question 9. Before performing a venipuncture, a phlebotomist must cleanse the site with an antiseptic. Which motion should be used? A. Back and forth scrubbing motion. B. Circular motion starting from the center outward. C. Up and down motion only. D. Random scrubbing in any direction. Answer: B. Circular motion starting from the center outward. Explanation: this question focuses on proper antiseptic technique for venipuncture, which is crucial for preventing infection. The keyword cleanse the site and motion points to the correct method. The standard procedure for applying an antiseptic, like isopropyl alcohol or chlorhexidine, is to use a circular motion, starting at the intended puncture site and moving outward in ever-widening concentric circles. This technique effectively moves microorganisms away from the clean puncture area, reducing the risk of contamination. Always clean in an expanding circle to ensure sterility at the puncture site. Question 10. Which of the following is the correct angle of insertion for a routine venipuncture with a straight needle? A. 5 to 10 degrees. B. 15 to 30 degrees. C. 45 to 60 degrees. D. 90 degrees. Answer: B. 15 to 30 degrees. Explanation: this question asks about the proper needle insertion angle for a standard venipuncture. The keyword correct angle and routine venipuncture refers to the typical approach. A 15 to 30 degree angle is optimal for entering most superficial veins, allowing the phlebotomist to penetrate both the skin and the vein wall without going straight through the vein. Too shallow an angle might not penetrate the vein, while too steep an angle could cause it to go through the vein completely. It's about finding that sweet spot to enter the vein smoothly. Question 11. After collecting a blood specimen, how long should pressure be applied to the venipuncture site? A. 15 to 30 seconds. B. 1 to 2 minutes. C. 5 to 10 minutes. D. Until the bleeding stops. Answer: D. Until the bleeding stops. Explanation: this question addresses post-venipuncture care, specifically the duration of pressure application. The keyword how long emphasizes the need for a definitive endpoint. Pressure should be applied directly to the puncture site until the bleeding has completely stopped, which varies from person to person. While 1 to 2 minutes is common for most patients, those on anticoagulants or with bleeding disorders may require longer. Ensuring hemostasis, the stopping of blood flow, is crucial to prevent hematoma formation. Question 12. A patient asks, "Can you tell me what tests my doctor ordered?" How should the phlebotomist respond? A. I cannot disclose that information, you need to ask your doctor. B. It's for a CBC and a chemistry panel. C. I'm not allowed to say, but you can look it up online. D. You'll have to wait until your doctor tells you the results. Answer: A. I cannot disclose that information, you need to ask your doctor. Explanation: this question tests ethical and legal responsibilities regarding patient information, particularly HIPAA. The keyword disclose highlights the confidentiality aspect. Phlebotomists are typically not authorized to discuss specific tests or medical information with patients, as this falls under the physician's responsibility to interpret and explain. Sharing such details could violate patient confidentiality, HIPAA, or lead to misinterpretations. It's best to kindly redirect the patient to their healthcare provider for test information. Question 13. Which of the following conditions might make a venipuncture more difficult due to vein issues? A. Dehydration. B. Hypertension. C. Obesity. D. All of the above. Answer: D. All of the above. Explanation: this question explores factors that can complicate venipuncture. The keyword difficult suggests needing to consider various challenges. Dehydration can cause veins to appear flattened and less prominent, making them harder to locate and puncture. Obesity can make veins deeper and less palpable due to layers of subcutaneous fat. While hypertension itself doesn't directly affect vein visibility, conditions often associated with it can. All these conditions can present challenges to a phlebotomist, requiring skill and adaptability. Question 14. What is the purpose of inverting blood tubes after collection? A. To warm the specimen. B. To prevent hemolysis. C. To mix the additive with the blood. D. To separate the plasma from the cells. Answer: C. To mix the additive with the blood. Explanation: this question asks about the critical step of inverting tubes after a blood draw. The keyword purpose points to the reason for this action. Inverting tubes gently multiple times ensures that the anticoagulant or additive within the tube is thoroughly mixed with the blood specimen, preventing clotting for anticoagulant tubes, or activating clotting for tubes with clot activators. Proper mixing is essential for accurate test results. Think of it as gently shaking a salad dressing to mix the ingredients evenly. Question 15. A phlebotomist needs to collect a specimen for a blood alcohol test. Which antiseptic should be avoided? A. Isopropyl alcohol. B. Chlorhexidine gluconate. C. Povidone iodine. D. Benzalkonium chloride. Answer: A. Isopropyl alcohol. Explanation: this question focuses on appropriate antiseptic use for specific lab tests. The keyword blood alcohol test and avoided means you must select an antiseptic that won't interfere with the test results. Isopropyl alcohol contains alcohol, which could falsely elevate the patient's blood alcohol level, making it unsuitable for this specific test. Instead, a non-alcoholic antiseptic like povidone iodine or chlorhexidine gluconate should be used to ensure accurate results. Always confirm antiseptic choice for specific test requirements. Question 16. What is the maximum time a tourniquet should be left on a patient's arm during venipuncture? A. 30 seconds. B. 1 minute. C. 2 minutes. D. 3 minutes. Answer: B. 1 minute. Explanation: this question assesses knowledge of proper tourniquet application time to prevent complications. The keyword maximum time emphasizes the limit. A tourniquet should not be left on for longer than 1 minute, as prolonged application can cause hemoconcentration, an increase in the concentration of cells and large molecules in the blood, which can alter test results, or even lead to petechiae or nerve damage. If you can't find a vein within a minute, release the tourniquet, allow blood flow to return, and reapply it or choose a different site. Question 17. Which of the following is considered a healthcare-associated infection, HAI? A. A patient gets a cold from a family member at home. B. A phlebotomist contracts hepatitis B from an accidental needle stick. C. A patient develops a urinary tract infection after catheter insertion in the hospital. D. A child gets chickenpox at school. Answer: C. A patient develops a urinary tract infection after catheter insertion in the hospital. Explanation: this question tests understanding of healthcare-associated infections, HAIs, also known as nosocomial infections. The key phrase healthcare-associated infection refers to infections acquired by a patient during a stay at a healthcare facility, which were not present or incubating at the time of admission. A UTI after catheter insertion in a hospital setting fits this definition perfectly. While a phlebotomist contracting hepatitis B is a Sharp's injury, it's an occupational exposure, not an infection acquired by a patient in the healthcare setting. Question 18. What is the primary purpose of a winged infusion set or butterfly needle? A. To draw large volumes of blood quickly. B. For patients with small or fragile veins. C. To prevent needle stick injuries. D. To perform arterial punctures. Answer: B. For patients with small or fragile veins. Explanation: this question asks about the specific utility of a specialized venipuncture device. The keyword butterfly needle points to its design and common use. Butterfly needles, also known as winged infusion sets, are designed with a smaller gauge needle and flexible tubing, making them ideal for venipuncture on patients with small, rolling, or fragile veins, such as pediatric or geriatric patients, or those with difficult access. Their design provides more control and reduces the risk of piercing through the vein. Question 19. A phlebotomist needs to collect blood from a patient with an N4 infusion running in the arm. What is the appropriate action? A. Turn off the 4 for 2 minutes and draw from the arm. B. Draw blood from the arm with the 4, but distal to the 4 site. C. Draw blood from the opposite arm. D. Draw blood from the same arm, proximal to the 4 site. Answer: C. Draw blood from the opposite arm. Explanation: this question addresses proper venipuncture technique when N4 is present. The keyword for infusion running indicates a potential interference. The safest and most accurate practice is to always draw blood from the arm opposite to where N4 is infusing. If blood is drawn from the same arm as N4, the 4 fluid could dilute the blood specimen, leading to inaccurate test results. If the opposite arm is not an option, drawing below, distal to, the 4 site after the 4 has been turned off for a period may be considered but is less ideal. Question 20. Which of the following is the proper way to dispose of a used needle after venipuncture? A. Recap the needle and place it in a regular trash can. B. Break the needle off and put it in a sharps container. C. Place the entire needle and syringe unit in a puncture-resistant sharps container. D. Place the needle in a biohazard bag for disposal. Answer: C. Place the entire needle and syringe unit in a puncture-resistant sharps container. Explanation: this question tests crucial knowledge of sharps safety and proper disposal to prevent needle stick injuries. The keyword dispose of a used needle emphasizes safety protocols. Needles should never be recapped, bent, or broken. The entire needle and syringe or adapter unit must be immediately discarded into a designated, puncture-resistant sharps container after use. This minimizes the risk of accidental needle stick injuries, protecting both the phlebotomist and others. Question 21. What is the term for the rupture or destruction of red blood cells, which can occur during improper blood collection? A. Hemostasis. B. Hemolysis. C. Hemoconcentration. D. Hematoma. Answer: B. Hemolysis. Explanation: this question asks about a common complication of blood collection and its definition. The keywords rupture or destruction of red blood cells directly define the term. Hemolysis is the breakdown of red blood cells, releasing hemoglobin into the plasma or serum, which can interfere with many laboratory test results. This can happen due to vigorous shaking of tubes, drawing blood through too small a needle, or excessive suction. Preventing hemolysis is crucial for accurate lab testing. Question 22. Which tube contains an anticoagulant that prevents clotting by binding calcium, and is commonly used for coagulation studies? A. Light blue. B. Green. C. Red. D. Gray. Answer: A. Light blue. Explanation: this question specifically links an anticoagulant mechanism to a tube color and its common use. The keywords anticoagulant that prevents clotting by binding calcium and coagulation studies are precise clues. The light blue top tube contains sodium citrate, which works by binding to calcium ions, an essential factor in the coagulation cascade, thus preventing blood from clotting. This makes it ideal for tests like PT and PTT. Remember that sodium citrate is the go-to for coagulation. Question 23. A phlebotomist performing a heel stick on an infant should use a lancet with a maximum depth of A. 1 mm. B. 2.0 mm. C. 2.4 millimeters. D. 3.0 millimeters. Answer: B. 2.0 millimeters. Explanation: this question addresses safety precautions for capillary punctures on infants. The keywords heel stick on an infant and maximum depth are critical for preventing injury. For infants, the maximum recommended depth for a heel stick lancet is 2.0 millimeters to prevent puncturing bone, which could lead to osteomyelitis, bone infection. Always select a lancet appropriate for the patient's age and weight to ensure safety. Question 24. Which vein is generally the first choice for venipuncture due to its size and accessibility? A. Basilic vein. B. Cephalic vein. C. Median cubital vein. D. Femoral vein. Answer: C. Median cubital vein. Explanation: this question asks about the preferred vein for routine venipuncture. The keywords first choice and size and accessibility point to the most common and safest option. The median cubital vein, located in the antecubital fossa, is typically large, well-anchored, and superficial, making it the ideal primary site for venipuncture. It also carries less risk of nerve or arterial damage compared to other veins in the area. Always start by assessing the median cubital vein. Question 25. Before leaving a patient's room, a phlebotomist should perform which of the following? A. Ask the patient if they need anything else. B. Document the venipuncture time. C. Ensure the patient is in a safe and comfortable position. D. All of the above. Answer: D. All of the above. Explanation: this question addresses comprehensive post-procedure patient care and documentation. The phrase "before leaving a patient's room" implies responsibility for patient well-being and proper record-keeping. A phlebotomist should always ensure the patient is comfortable and safe, thank them, and document the procedure, including the time of collection. These steps are crucial for patient care, safety, and maintaining accurate medical records. It's about providing a complete and professional experience, from start to finish. Question 26. What does NPO mean in a patient's medical instructions? A. No pain medication ordered. B. Nothing by mouth. C. Normal daily activity. D. No physical contact. Answer: B. Nothing by mouth. Explanation: this question tests knowledge of common medical abbreviations that impact phlebotomy procedures. The abbreviation NPO is a widely used instruction. NPO stands for nil per os, which is Latin for nothing by mouth. This instruction is given to patients who need to fast before certain lab tests, like glucose or cholesterol, or procedures to ensure accurate results or prevent complications. Always confirm NPO status before drawing fasting labs. Question 27. Which needle gauge has the largest lumen, inner diameter? A. 25 gauge. B. 23 gauge. C. 21 gauge. D. 18 gauge. Answer: D. 18 gauge. Explanation: this question assesses understanding of needle gauge sizes. The keyword largest lumen refers to the widest opening of the needle. In needle sizing, the smaller the gauge number, the larger the needle's inner diameter, lumen. An 18-gauge needle has a significantly larger lumen than a 25-gauge needle, which is a very small bore. Larger gauges, smaller numbers, are typically used for blood donations or rapid infusions, while smaller gauges, larger numbers, are for routine venipuncture or fragile veins. Question 28. What information must be included on a blood specimen label? A. Patient's full name, date of birth, date of collection, time of collection, phlebotomist's initials. B. Patient's room number, physician's name, date of collection. C. Patient's diagnosis, allergies, and test requested. D. Patient's insurance information and primary contact. Answer: A. Patient's full name, date of birth, date of collection, time of collection, phlebotomist's initials. Explanation: this question focuses on essential information for specimen labeling, crucial for patient safety and accurate testing. The phrase "must be included" indicates mandatory data. Accurate labeling requires at least 2 patient identifiers, full name and date of birth, the date and time of collection, and the phlebotomist's initials. This ensures the sample is correctly matched to the patient and laboratory order, preventing misidentification errors. Always label tubes at the patient's bedside immediately after collection. Question 29. A phlebotomist must collect a trough level for a medication. When should this blood specimen be drawn? A. Immediately after the next dose is administered. B. Just before the next scheduled dose is administered. C. Midway between doses. D. Any time, as long as the patient has been taking the medication. Answer: B. Just before the next scheduled dose is administered. Explanation: this question tests knowledge of specific timing for therapeutic drug monitoring, TDM. The keyword trough level is the key indicator. A trough level represents the lowest concentration of a medication in the patient's bloodstream, typically measured just before the next scheduled dose is given. This helps healthcare providers ensure the drug concentration remains within the therapeutic range without becoming toxic. Remember, trough means the lowest point, so it's always before the next dose. Question 30. Which test requires special handling to protect the specimen from light? A. Glucose. B. Bilirubin. C. Hemoglobin. D. Electrolytes. Answer: B. Bilirubin. Explanation: this question asks about a specific pre-analytical requirement for certain tests. The keyword "protect the specimen from light" is the direct clue. Bilirubin, a product of red blood cell breakdown, is highly photosensitive and can be degraded by exposure to light, leading to falsely decreased results. Specimens for bilirubin testing must be collected in amber-colored tubes or immediately protected by wrapping the tube in foil or placing it in a light protective bag. Always think foil for bilirubin. Question 31. What is the correct term for the fluid portion of blood that remains after coagulation, clotting, has occurred? A. Plasma. B. Serum. C. Whole blood. D. Formed elements. Answer: B. Serum. Explanation: this question defines a key component of blood often used for testing. The phrase "fluid portion of blood that remains after coagulation, clotting, has occurred" is the precise definition. Serum is the liquid portion of blood that separates from the clot after blood has been allowed to clot. It is essentially plasma minus the clotting factors, primarily fibrinogen. If you let a red top tube clot and spin it down, the clear liquid on top is serum. Question 32. Which of the following is an example of implied consent? A. A patient signs a consent form for a surgery. B. A patient verbally agrees to have blood drawn. C. A patient extends their arm for a venipuncture. D. A patient's guardian signs for a minor. Answer: C. A patient extends their arm for a venipuncture. Explanation: this question addresses different types of consent in healthcare. The keyword implied consent refers to consent that is not directly expressed but is inferred from a person's actions or circumstances. When a patient extends their arm to a phlebotomist, it implies their willingness to undergo the blood draw without verbally stating yes or signing a document. This is considered an acceptable form of consent for routine procedures like venipuncture. Question 33. Which organization sets the standards for venipuncture procedures, including the order of draw? A. WHO, World Health Organization. B. CDC, Centers for Disease Control and Prevention. C. CLSI, Clinical and Laboratory Standards Institute. D. OSHA, Occupational Safety and Health Administration. Answer: C. CLSI, Clinical and Laboratory Standards Institute. Explanation: this question asks about the authoritative body that establishes guidelines for laboratory practices. The keywords "sets the standards" and "venipuncture procedures," including the order of draw, point to the specific organization. The Clinical and Laboratory Standards Institute, CLSI, publishes guidelines and standards that are widely adopted by healthcare facilities and laboratories worldwide to ensure quality and consistency in laboratory testing, including phlebotomy. Think of CLSI as the rulebook for phlebotomy best practices. Question 34. A phlebotomist is collecting a routine venipuncture. The patient complains of sharp, radiating pain down the arm. What is the most likely cause? A. Vein collapse. B. Arterial puncture. C. Nerve involvement. D. Hematoma formation. Answer: C. Nerve involvement. Explanation: this question addresses potential complications during venipuncture. The keywords sharp, radiating pain are classic indicators of nerve irritation or damage. If a patient experiences sudden, sharp, shooting, or electrical-like pain that radiates down the arm or into the hand, it suggests the needle has come into contact with or is very close to a nerve. The phlebotomist should immediately remove the needle and apply pressure. Always listen to patient complaints of pain and stop if nerve involvement is suspected. Question 35. After centrifuging a red top tube, what is the liquid portion called? A. Plasma. B. Serum. C. Buffy coat. D. Whole blood. Answer: B. Serum. Explanation: this question describes the result of processing a specific type of blood tube. The keywords red top tube and after centrifuging are crucial. A red top tube contains no anticoagulant, so the blood clots after collection. When this clotted blood is centrifuged, the solid clot settles at the bottom, and the clear, yellowish liquid portion that remains on top is called serum. Remember, red tubes yield serum because the blood clots. Question 36. Which type of personal protective equipment, PPE, should a phlebotomist wear when there is a risk of blood splashing? A. Gloves only. B. Gloves and gown. C. Gloves, gown, and face shield. D. Face shield only. Answer: C. Gloves, gown, and face shield. Explanation: this question focuses on appropriate PPE for situations with splash risk. The keyword blood splashing indicates a need for comprehensive barrier protection. In situations where there is a reasonable anticipation of splashes or sprays of blood or other potentially infectious materials, full PPE, including gloves, a fluid-resistant gown, and a face shield or goggles with a mask, is required to protect the phlebotomist's skin and mucous membranes. Better safe than sorry when it comes to blood-borne pathogens. Question 37. When collecting blood for a blood culture, what is the primary reason for using antiseptic solution for skin preparation? A. To numb the area for the patient. B. To remove visible dirt from the skin. C. To kill microorganisms on the skin to prevent contamination. D. To make the veins more prominent. Answer: C. To kill microorganisms on the skin to prevent contamination. Explanation: this question highlights the critical importance of antiseptic technique for blood culture collection. The keywords blood culture and antiseptic solution and primary reason point directly to infection control. Blood cultures are highly sensitive to contamination from skin flora. The rigorous antiseptic preparation aims to kill transient and resident microorganisms on the skin surface to prevent them from entering the blood culture bottles and causing a false positive result. This ensures the lab can accurately identify any true bloodstream infections. Question 38. A phlebotomist is preparing to perform a venipuncture on a patient with fragile, rolling veins. Which venipuncture device would be most appropriate? A. 18-gauge straight needle. B. 21-gauge straight needle. C. Winged infusion set, butterfly. D. Syringe with a large gauge needle. Answer: C. Winged infusion set, butterfly. Explanation: this question asks about selecting the best equipment for challenging veins. The keywords fragile, rolling veins are the key clues. For such veins, a winged infusion set, butterfly needle, is typically the most appropriate choice. Its smaller needle size, often 23 or 25 gauge, shallower angle of insertion, and flexible tubing provide better control, reduce vein trauma, and minimize the risk of the vein rolling away or collapsing. It's designed for delicate situations. Question 39. What is the correct procedure for labeling blood tubes after collection? A. Label before the blood draw. B. Label at the nursing station. C. Label immediately at the patient's bedside after collection. D. Label in the laboratory. Answer: C. Label immediately at the patient's bedside after collection. Explanation: this question tests a critical safety step in the phlebotomy process. The keyword correct procedure for labeling and after collection directs to proper practice. Tubes must be labeled immediately at the patient's bedside after the blood is drawn and before leaving the patient. This crucial step prevents mislabeling, which can lead to severe medical errors. Always verify patient information against the requisition and label in front of the patient. Question 40. Which of the following is a common cause of specimen rejection in the laboratory? A. Specimen collected with proper technique. B. Specimen collected in the correct tube. C. Specimen hemolyzed. D. Specimen transported immediately. Answer: C. Specimen hemolyzed. Explanation: this question focuses on reasons why a laboratory might not be able to process a blood sample. The keyword specimen rejection and common cause are key. Hemolysis, the rupture of red blood cells, releases intracellular components that interfere with many laboratory tests, leading to inaccurate results. Laboratories often reject hemolyzed specimens because their integrity is compromised, making the results unreliable. Avoid vigorous mixing or drawing through too small a needle to prevent hemolysis. Question 41. Which condition could contraindicate, make it unsuitable, drawing blood from a specific arm? A. Presence of a fistula or shunt for dialysis. B. Previous venipuncture in that arm. C. Patient states they prefer the other arm. D. Arm has a small tattoo. Answer: A. Presence of a fistula or shunt for dialysis. Explanation: this question asks about situations that absolutely prevent drawing blood from an arm. The phrase contraindicate drawing blood and fistula or shunt for dialysis are the strong indicators. A fistula or shunt, typically found in patients with kidney failure undergoing dialysis, is a surgically created connection between an artery and a vein. Drawing blood from or applying a tourniquet to an arm with a fistula or shunt can damage the fistula, compromise its function, or cause serious complications. Always avoid this arm. Question 42. How should a phlebotomist react if a patient refuses to have blood drawn? A. Try to convince the patient to cooperate. B. Document the refusal and notify the nurse or physician. C. Explain the importance of the test and insist on drawing. D. Inform the patient that they will be discharged if they refuse. Answer: B. Document the refusal and notify the nurse or physician. Explanation: This question addresses patient rights and professional response to refusal. The keyword refuses highlights the patient's right to decline medical procedures. If a patient refuses, the phlebotomist must respect their decision. The correct action is to calmly document the refusal, including any stated reasons, and then notify the patient's nurse or the ordering physician. This allows the medical team to address the refusal and determine the next steps in the patient's care plan. Question 43. What is the correct action if the phlebotomist accidentally sticks themselves with a contaminated needle? A. Immediately wash the area with soap and water. B. Inform the patient about the incident. C. Apply a bandage and continue working. D. Wait to report until the end of the shift. Answer: A. Immediately wash the area with soap and water. Explanation: This question focuses on immediate first aid for a sharps injury, crucial for preventing infection. The keyword accidentally sticks themselves with a contaminated needle indicates an urgent need for action. The immediate first step after a needle stick injury is to thoroughly wash the affected area with soap and water. This helps to remove any pathogens. Following this, the incident must be reported to a supervisor, and appropriate follow-up care, including testing, should be initiated. Question 44. Which tube is typically used to collect blood for a blood glucose test? A. Red top. B. Green top. C. Gray top. D. Lavender top. Answer: C. Gray top. Explanation: This question asks about the specific tube for glucose testing. The keyword blood glucose test is the direct clue. The gray top tube contains sodium fluoride, which acts as an antiglycolytic agent, preventing glycolysis, the breakdown of glucose, by red blood cells. This ensures that the glucose level measured in the lab accurately reflects the patient's blood glucose at the time of collection. Remember gray for glucose. Question 45. What is the correct way to identify an unconscious or unknown patient? A. Use the patient's room number. B. Check the identification band against the requisition, and confirm with a nurse. C. Ask a family member to identify the patient. D. Rely on the patient's chart at the bedside. Answer: B. Check the identification band against the requisition, and confirm with a nurse. Explanation: This question tests safe patient identification for those unable to provide information. The keywords unconscious or unknown patient highlight the challenge. In such cases, the phlebotomist must rely on the patient's identification band. The information on the band, e.g., name, medical record number, must be carefully matched to the laboratory requisition. Additionally, a nurse or another authorized healthcare professional should be asked to verbally verify the patient's identity. Never rely on room numbers or charts alone. Question 46. What does hemostasis refer to in the context of phlebotomy? A. The breakdown of red blood cells. B. The process of stopping bleeding. C. The formation of a blood clot within a vessel. D. The separation of blood components. Answer: B. The process of stopping bleeding. Explanation: this question defines a key physiological process relevant to venipuncture. The term hemostasis in phlebotomy directly relates to the body's natural response to injury. Hemostasis is the complex physiological process by which blood flow is stopped at the site of injury, involving vasoconstriction, platelet plug formation, and coagulation, clotting. Phlebotomists aid this process by applying pressure after a blood draw. It's the body's way of patching up a leak. Question 47. A phlebotomist is drawing blood from a patient in isolation. What is the final step before leaving the room? A. Don a clean gown. B. Remove gloves first, then perform hand hygiene. C. Remove all PPE and perform hand hygiene outside the room. D. Remove all PPE inside the room and perform hand hygiene. Answer: D. Remove all PPE inside the room and perform hand hygiene. Explanation: this question focuses on proper PPE removal and hand hygiene protocols in an isolation setting. The keywords isolation and final step before leaving are crucial. All personal protective equipment, PPE, should be carefully removed inside the isolation room to contain potential contaminants within that area. After removal, meticulous hand hygiene, hand washing or alcohol-based hand rub, must be performed inside the room before exiting. This prevents the spread of pathogens outside the isolation environment. Question 48. Which of the following tests requires fasting for accurate results? A. CBC, complete blood count. B. Electrolyte panel. C. Lipid panel. D. Thyroid stimulating hormone, TSH. Answer: C. Lipid panel. Explanation: this question asks about specific tests that require pre-analytical patient preparation. The keyword fasting indicates a dietary restriction. A lipid panel, which measures cholesterol and triglycerides, requires the patient to fast for 9 to 12 hours prior to collection. This ensures that the results reflect the patient's baseline lipid levels and are not influenced by recent food intake, which can temporarily elevate triglyceride levels. Always confirm fasting status for lipid panels. Question 49. When performing a capillary puncture, what is the purpose of wiping away the first drop of blood? A. To prevent hemolysis. B. To remove tissue fluid contamination. C. To check for proper blood flow. D. To clean the puncture site. Answer: B. To remove tissue fluid contamination. Explanation: this question addresses a specific step in capillary blood collection. The keywords capillary puncture and wiping away the first drop are essential. The first drop of blood from a capillary puncture often contains excess tissue fluid, which can dilute the specimen and interfere with accurate test results, particularly for glucose. Wiping away this initial drop ensures that the subsequent drops are pure blood, providing a more accurate sample for analysis. Always aim for a clean second drop. Question 50. A phlebotomist must use a blood collection tube with a clot activator. Which tube color indicates the presence of a clot activator? A. Light blue. B. Green. C. Red, plastic, or gold/tiger top. D. Lavender. Answer: C. Red, plastic, or gold/tiger top. Explanation: this question asks about tube additives designed to promote clotting. The keyword clot activator is the key indicator. While traditional red top tubes may have no additive, many modern plastic red top tubes and serum separator tubes, SSTs, often gold or tiger top, contain a clot activator, like silica particles, to speed up coagulation. This allows for quicker separation of serum after centrifugation for chemistry and serology tests. Remember that red or gold tubes are for getting serum by promoting clotting.